Bonjour tout le monde. Hello, everyone. Welcome to today's online event. The purpose of today's event is twofold. We will begin with a pre-recorded webinar from our N4 conference featuring very wonderful speakers who will discuss IRCC's Afghan Resettlement Initiative. Following this, we will segue into the formal launch of the N4 Afghan Resettlement Toolkit. Before we begin today's event, we would like to begin with an acknowledgement that N4 is hosted at CHIO, which is located in Ottawa, Ontario. Ottawa is built on unceded Algonquin Anishinaabe territory. The peoples of the Algonquin Anishinaabe Nation have lived on this territory for millennia, and we honor them and this land. Their culture and presence have nurtured and continue to nurture this land. We also honor all First Nations, Inuit, and Métis peoples and their valuable past and present contributions to this land. My name is Mariah. I use the pronouns she and her, and I'm a project coordinator on the N4 team. I will be hosting and moderating today's event. My co-host, Andrew Tomeyer, will be monitoring the question and answer box today. And I am now pleased to introduce to you today's speakers, Mr. John Biles and Ms. Amal Remu. And I'll just invite our speakers to turn on your camera as I introduce you. Mr. John Biles is currently the Acting Senior Director of the Settlement Network, responsible for resettlement operations. In this role, he is responsible for the management and coordination of the delivery of the Resettlement Assistance Program across Canada. He and his team have recently joined the new Afghanistan Settlement Branch under Director General Corinne Prince. From 2013 until early 2021, John held roles as the Director or Assistant Director of Settlement and Integration for the Prairies and Northern Territories region. Throughout his career, John has held various positions with the Metropolis Project, an international policy research network focused on immigration, integration, and diversity, and as a special advisor to the Director General of the Policy Branch responsible for settlement. While his interests in settlement and integration and inclusion are fairly eclectic, and he has published widely in these broad areas, his interest in how resettlement works across Canada from coast to coast has cut across all of his professional experience. John holds a bachelor's degree from McGill and Concordia Universities, a master's degree from Carleton University, and a certificate in nonprofit management from Mount Royal University. Welcome, Mr. Biles. Thanks so much for being here today. And our next speaker today is Ms. Amal Remu. Ms. Remu is currently the Assistant Director of the Settlement Network Resettlement Operations Directorate, responsible for health, quarantine, and hotels for Afghanistan refugees. She has very recently joined Settlement Network from the Public Health Agency of Canada, where she was responsible for Western operations of the quarantine services for the last 18 years. Ms. Remu holds a bachelor's degree in education and nursing from the University of Calgary, along with an international management audit training certificate from the London School of Economics. She's currently enrolled in the Masters of Public Health at the University of Victoria. Thank you, Mr. Biles and Ms. Remu, for joining us today. Today's session is being recorded and we will upload it to our N4 platform following the event. We will share this with you as soon as it becomes available. And should there be any technical issues during this webinar, we will inform you with details for an alternate makeup session. And before we begin today's event, I do want to take a moment to introduce you to our platform features to enhance your participation experience. Throughout today's session, we invite you to write your questions using the question and answer window. And we know that sometimes many of you might have a similar question or be interested in a particular response. So today you have the option of upvoting a question. Please upvote which questions you're interested in hearing the answer to, and we will prioritize which question we pose to our speakers first. And our speakers today have no conflicts of interest to declare. And with that said, let's jump right into today's webinar. Before we jump into the recording, Mr. Biles or Ms. Remieux, would you like to provide some initial remarks? Okay, we will jump right into today's session.
It's afternoon now for those of you in time zones where it's afternoon, or this morning if you're in the West like me. As mentioned, I'm in the Afghanistan Settlement Branch at IRCC. Today, I am the Acting Director General, as our Director General is an acting assignment, Corinne Press. Normally, you would get the pair of us. Collectively, we think of the group that you represent in this conference as a really important group of stakeholders that help us collectively resettle refugees to Canada. And as you can see from some of the images that have been showing while we're sorting out the technical difficulties, a picture really does speak 1,000 words. And unfortunately, events globally have crept up on us so that these photos, which are of Afghan arrivals to Canada, which has kept us all very busy since last August, are now all too common in those countries surrounding Ukraine as well. So the work that you do just from the outset, let me emphasize, is vitally important. And you're important partners for us as a department, and we appreciate what you and your partners do every day. La présentation sera disponible dans les 2 langues officielles et bien sûr, s'il vous plaît, demandez vos questions dans la langue officielle de votre choix. Mais aujourd'hui, je présente en anglais just to make it a little bit easier for the interpreters. And so what we wanted to walk through today in the coming half hour is simply what is and is not the Afghanistan Resettlement Initiative, and where are the connections with the work that you do in the everyday in the health and the case management space. So I imagine everybody is aware why Afghanistan and why now. And these are the formal connections from the government of Canada. It's a long-standing relationship and commitment between the government and the people of Canada and those that we're trying to assist from Afghanistan. There was a commitment immediately prior to the fall election last year for 20,000 to be resettled to Canada. During the election, that commitment doubled to 40,000. And we are very much in the midst of that movement today, and we have been since the first flight arrived in Canada on August the 8th. So what are the special immigration measures? These, largely speaking, are designed by the government specifically to engage with those that assisted Global Affairs Canada or the Canadian Armed Forces during the duration of their active engagement in Afghanistan, who are in direct harm's way within Afghanistan as a result of the assistance that they have provided to Canada. In addition, a special humanitarian program was announced, which are for the categories that you can see on the screen before you. Very important to consider that these are for those that don't have a durable solution in a third country. When you're watching the evening news today and over the last week about the Ukraine, that is the key element around refugee determination status at the international level. Is without a durable solution in a third country. And so you can see the prioritized categories that were announced under the humanitarian program: women leaders, human rights defenders, persecuted religious or ethnic minorities, LGBTI individuals, and journalists, and those individuals who helped Canadian journalists in the conflict in Afghanistan. How many have we received thus far? There is a web page on IRCC site that's updated weekly with those that have arrived. And As of February the 18th, you can see that we were just under 8,000 that had arrived from across those streams. And we are very much on track before March 31st for that number probably to be just shy of 10,000, with those that are booked on commercial travel opportunities or on charter flights. And just below that, you can see kind of a sense of the volume of what has been applied for and processed. And that gives you the delta of where are we in terms of arrivals versus those that are ready to travel. And as we'll get into in a little bit, exiting Afghanistan is tremendously difficult. And as a result, the flow is not nearly as rapid as you see in traditional resettlement movements, or even as you're seeing across the Ukraine, Polish, and other borders when you watch the news at present. The border is largely speaking sealed, with only a few exit opportunities to take advantage of. Resettlement, for many of you, this will be old hat, and you'll be very aware. We do resettle government-assisted refugees to what was 34 communities across Canada, and will be by April 41 communities across Canada. And the government of Quebec, under the Canada-Quebec Accord, also resettles to 14 locations within Quebec, for a total of 55 resettlement communities across the country where government-assisted refugees are provided with services, including finding them permanent accommodations and connecting them to a wide range of local, social, and other program supports, most notably for the work you do for the healthcare systems in each of those communities. So, early days of the Afghanistan movement really began in around about mid-July, when things started to become much more concrete about impending arrivals. We did opt initially during the evacuation phase for a centralized approach, simply because most Canadian airports were closed to international flights as a result of the pandemic. And an awful lot of the airport capacity that you would have seen in Montreal and Toronto during Operation Syrian Refugee simply no longer existed as a result of a decrease in international arrivals. And so everything from buses to terminal space to processing was at a premium at Pearson. And it took us some time to broker a solution that would allow charter flights or military flights direct from Kabul to Toronto. And again, because of both the security situation and of the global pandemic, the requirements to gate an aircraft, offload passengers through the normal terminal were not met. And so working with CBSA and the Pearson Airport Authority and the Public Health Agency of Canada and the impacted public health authorities in Ontario and at their local health providers, developed a tent city solution where the aircraft would be offloaded on the tarmac itself. People would be processed for immigration, for health, and onto buses and onwards to the quarantine hotels that were managed by the Polycultural Immigrant and Community Services that you see here. We did initially set up for 16 days of quarantine, 14 to meet the requirements, and an extra 2 days to try to get other components of the work done before the individuals arriving in that evacuation phase would be onward destined to one of the 41 communities outside of Quebec that we talked about just moments ago. There was an incredible amount of collaboration in the health space across multiple levels of government to resolve both the COVID concerns and, as we'll talk about as we move along, this is not a heavily vaccinated population, and there have been, will be outbreaks of other communicable diseases of concern to public health that also have to be managed. Very fortunately, many of the same measures that work for COVID work for some of these other diseases. We worked very closely with the testing regime to have COVID testing completed on day 1 and 8 in the quarantine hotels. And then on day 10, once they had a clean bill of health from the day 8 COVID test, we would set about the immigrant medical exams with local healthcare providers. Normally that is done before arriving in Canada, but given the circumstances in Kabul, it simply was not possible pre-arrival. We've also worked with all of the resettlement agencies to develop a standardized needs and asset assessment for the Afghan government-assisted refugees in order to gather information that will help with conversations with both the settlement providers, but also the broader ecosystems of those systems, including yours, that are engaged with providing services to this population as the flow continues and as their journey moves forward. Unusually for us in the government-assisted refugee space, we did have complications with arrivals of families with mixed immigration status. We had individuals that were citizens that were already permanent residents that were in the midst of family reunification applications. And as a result, unlike most GAR arrivals where they all arrive and are permanent residents upon arrival, and the entire family is treated the same way, from an eligibility perspective. We had families here where some family members were eligible and some weren't. Some had incomplete immigration processes. Some had more complexities than that. And a lot were issued temporary residence permits until their immigration processing could be resolved, which is something that our RAP agencies, the Resettlement Assistance Program agencies, don't typically deal with. And that has meant longer stays in hotels, while all of those different steps on both health and immigration have been resolved before they can move to permanent locations. And as I'm sure you can all envision, a long stay in a hotel room under first quarantine and then the stress of knowing final status is not good for anyone's mental or physical health. And so we've been working closely with our partners to mitigate and to resolve those issues as quickly as we can. Needs and assets assessments. Typically, these are done by our providers and they're at quite a high level. And what we've ascertained from Operation Syrian Refugee is something a little bit more specific would be quite helpful. For example, with the Syrians, simply knowing they need health access didn't help us narrow in on the fact that they needed a large number of dentists and OB-GYNs because of the very large number of pregnant women that were in the group versus other forms of healthcare that are a little bit more typical to GAR flows. And so gathering that information early would let each RAP agency engage with their local health partners to get the right connections lined up at the earliest possible moment. And so the partners would be in less reactive mode as people came through the door and a little bit more able to plan for what they were going to see next. We are doing this at 3 moments in time. The first stage is while they're in temporary accommodations, and it's very much focused on the urgencies of life, on Maslow's hierarchy of need. It's really those first elements that are focused on then. A second stage happens once they've moved into permanent accommodations, and then a third when they're coming to the end of their first year of financial support from either their private sponsors or for the government. So what happens once they come into the hotel scenario? So just in a little bit more detail on this slide, you can see what we've already mentioned, the COVID testing, urgent primary health care. So on the tarmac at Pearson during the evacuation phase, we did have a Government of Ontario funded urgent healthcare team that would whisk people away, update their prescriptions, get them the specialist care referrals. We had people who were due any moment. We had people in pretty dire health circumstances that needed specialists right away. And so that was done right on the tarmac. And they didn't even get to the hotel before they went to the appropriate healthcare officials. Then we also had nursing clinics in the quarantine hotels that were serving in the everyday and acting as a triage function to make the out referrals to the specialists where required. And that was a very busy role, especially during the evacuation phase. We still have nurses in the quarantine hotels, but they're significantly less busy than they were prior because most people were receiving today have had opportunity to access services and are not leaving an active war zone prior to coming to Canada. Day 10, the service providers worked with local panel physicians and took people to the immigration medical exams, the results of which were required before we could complete their permanent residence processing. An important piece next, the Canadian orientation abroad. Somewhat ironically in this flow, given the evacuation nature of the movement, was not given while they were abroad, but rather was delivered while they were in quarantine. We right at the beginning ascertained that 16 days in quarantine meant that we wanted to make it as productive and as painless as possible for all concerned. So we worked with our providers and as a pilot basis issued a loan of a Chromebook to everybody over the age of 5, and then sought to have programming that is age appropriate made available to the different members of the family, including Canadian orientation abroad, that they could receive virtually, since we couldn't do this in a face-to-face manner. We partnered with Service Canada, and many of you may remember from Operation Syrian Refugee, most were issued SIN numbers at Pearson or Trudeau Airport before they departed. Those kiosks have been closed during COVID, and so we arranged for them to set it up in the quarantine hotels, so people could be escorted down from their room to get their SIN application and their number before they left the hotels. And then their travel was booked on to the final destination. Just a note on interim federal health. In all but 2 provinces, it's instantaneous pagars. And in 2 provinces, we negotiated to have it extended to cover them from the moment they touched down until they reached their final destination. And so there was access to, in this case, in Toronto for the early months, OHIP, while they were in the hotels. Once they get to their final destination, typically we're seeing between 2 and 3 weeks in temporary accommodations. During that period of time, as most of you I'm sure are aware, they're getting an orientation to Canada, they're getting their connection to a primary healthcare network wherever possible. In some locations, as I'm sure you know, access to primary physicians for anyone, no matter how long they've lived in the community, is a time-consuming element. Kids are registered in school. Permanent accommodations that are safe, affordable, and appropriate are identified, and we seek to move them into their permanent accommodations so they can begin the next phase of their settlement. Oftentimes that housing is sought in neighborhoods where the appropriate services are located, whether that is ethnocultural, settlement services, educational, healthcare related, so that it facilitates the next stages of their settlement as we move forward. So, as I mentioned, we did initially begin with a focal point on Toronto. All of the evacuation flight charters arrived in Toronto. And what we quickly ascertained was that the Afghan refugees arriving were extremely reluctant to move on to the other elements in the resettlement network in the 55 communities, including those in Quebec, across the country. And we're in the middle of a housing crisis, and the capacity of the resettlement network is distributed across the country. Our ability to meet the basically doubling of government-assisted refugee arrivals to include the Afghan commitment is directly related to the ability to move people through, find them housing, get them connected to services in all 55 communities. And so as it became clear that this was going to be difficult to accomplish, with everyone arriving in Toronto, meeting people in the quarantine hotels, staying there for 16 days or longer, depending upon their immigration processing, meant that they already had connections in Toronto that they were very reluctant to give up. And because we knew we could not meet the requirements if we stayed with this model, we started looking at direct destining mass arrivals to other locations, so that same sense of community would build during the quarantine period, and we would make greater use of a wider range of resettlement communities across the country. just like with the Syrians and any other refugee flow, lots of people have pre-existing family ties to Canada. We still try to recognize those and destine people based where they have family ties. But importantly, for government-assisted refugees, it's not a system designed on choice or on loose ties like I met someone on the plane, or I have a friend that I once knew that lives in, because the capacity to assist and find the permanent housing and the supports is distributed across the country. So only those individuals with direct family ties continue to be destined to Toronto, and the rest are being destined across the entire network. We get asked very often, why is this not operating like Operation Syrian Refugee? Why can't you do it the same way? And I simply could not say this better than our minister on the slide here, who I think lays out very well the differences in terms of in Syria. We were able to set up in a number of specific locations, negotiate with those governments, line up the services, and then simply operate an air bridge between those locations, Montreal, Toronto, and onwards. Afghanistan has been taken over by an internationally identified terrorist organization, and the borders are largely closed. There is no possibility of being able to manage from within the country. And so we are dealing with individuals as they exit the country and working closely with third parties and third countries. And as rapidly as people pop up, we are working to get them on either commercial aircraft or charters where it makes sense to do so financially. Remembering that we do have immigration loans, and the cost of that transportation is borne by the government-assisted refugees. So our partner, the International Organization for Migration, is always looking for that sweet spot of the fastest and the least expensive options to transport people to Canada. So what do we learn from Operation Syrian Refugee? In part, that explains why we're eager to talk to you today. So the importance of information sharing with stakeholders. It takes all of us to make this movement work and to launch people on a successful journey in Canada. Doing that also requires an ability to harness public support. Everybody wants to help. And I think in OSR, there was a sense that the capacity to engage those that wanted to help was not optimal, was not able to engage everyone. And then the need to make some adjustments to how we do processing was very evident in OSR. And they are things that we continue to do in this cycle. In the second half of the slide, you can see the need for end-to-end planning, thinking this through. We're already having discussions with partners around month 13, the end of the federal income support, and what that looks like, and what are the bridges and crosswalks to settlements and to broader organizations and systems that will be integral to the integration of these families for years to come. A need for better information. I think any of you who are involved with OSR will remember we got a population profile that told us, here's what we know about the population in general. And then as the GARs began to arrive, we recognized that that might be a good population profile for the total number of Syrians outside of Syria, but it was not reflective of the highly vulnerable that were selected for resettlement to Canada. And we had to very quickly pivot and try to develop better information. And that's why we focused on the standardized NARS. A very big one for us is a focal point on stakeholder coordination and communication, which we'll talk about, I think, in a minute or two. Adding capacity to the settlement program where we know we're going to need it is a direct outgrowth of the standardized NARS. And then the last two, trying to ascertain what to do around the pacing of arrivals, which, as the minister's comments have indicated, is darn near impossible for us in the Afghan movement, because every third country has a clock on how long they're prepared to entertain people destined to Canada remaining on their territory. And so many of them, Pakistan's a good example, 30 days. And if we don't respect the 30 days of movement, people will be returned to the other side of the border, which nobody wants. And so that sometimes elicits a last-minute charter when the commercial capacity is not there. Our Francophone partners felt in Operation Syrian Refugee that they had not been engaged early enough, even if there were relatively few Francophones in that GAR population. In the Afghanistan instance, we've been working with them from the outset, not because there's a large number of French-speaking Afghan GARs. There are some, but not a large number, but because those communities can absolutely help resettle anyone regardless of their official language knowledge, and have a lot of partnerships that can add capacity that is needed across the country. In addition, we had already launched prior to Afghanistan a new call for proposals looking to add capacity in two critical areas that we felt we required to meet the elevation in GAR arrivals in the levels plan in the midst of a pandemic. And as a result, this actually looks prescient because it also obviously helps us with Afghanistan numbers. So we were looking to add new RAP centers across the country, particularly in the West and in Atlantic Canada. There's a pretty comprehensive set of them in Ontario and some satellites that operate in conjunction with the main service providers. And then also an expansion of the case management work that we've been looking to nationalize over the last number of years, which is the wraparound service for the most vulnerable clients we see in settlement, which is many government-assisted refugees, but is not exclusive to them, and particularly looking at how we add that case management capacity in smaller centers. And so you can see some of the work we have on this slide is very similar to the work you're doing. We have different models for case management across the country, and we want to make sure that we create the space for them to come together, share best practices, figure out what the commonalities could or should be, and consistency and capacity, and where regional variation or local variation is required to respond to the ecosystem. We have a conference next week being organized by our British Columbia service providers in this space. And so we are looking to make some enhancements between now and the end of our current fiscal cycle, which is March 31st, 2025, and make sure that we have the capacity to assist the Afghans. And a lot of case management work intersects with the healthcare provider systems across the country. And our goal is, by our national call for proposals in 2024, to have some standards and outcomes in place in order to ensure consistency and equity for both our providers and our clients in accessing services, regardless of where they land in Canada. Just some key challenges that we've already seen as we're moving forward. I'm not going to get into them in a great deal of detail, but it is suffice to say that housing is a real challenge for everybody, and especially for government-assisted refugees on a finite budget. And we have been taking steps with our service providers and with the funding made available to try to alleviate that, as well as working on the supply side, like every other order of government for every other population in Canada, to try to resolve that. And I will say that we are experiencing, or the families that we are receiving are heavily bifurcated. It is largely, but not exclusively, gendered, where we have a lot of principal applicants with reasonably high or high official language skills and employment backgrounds. And we have spouses that have very low official language skills, or very low levels of education, or both. And so we are looking at settlement pathways that assist both of those in the adult population. And of course, our national investments, which is about $100 million a year in settlement workers in schools, is very much looking at the school age population and what do we need to be doing to assist in that space. And employment is one of those areas where we have people that were working at the Canadian Embassy the day before they got on a plane and wish to resume working before they're even out of the quarantine hotel. And so connecting those that have a long journey towards employment and those where it can be almost instantaneous is something that we're still focusing on with our employment-related service partners. Ongoing health challenges, as I mentioned at the beginning, we're very preoccupied with the mental health and well-being Physical health, many of the partnerships are in place. It's extremely important, but we're not seeing the same demands on the physical health that we saw with the Operation Syrian Refugee movement yet. This may change as time goes on, but we are unquestionably seeing everybody is arriving with some level of mental health and trauma because of the proximity of the actions. And as I'm sure you can well imagine, you barely make it on a plane as the city is falling to the Taliban. You then are in a hotel room for 16 days, which has very little to do except the television, and where 24/7 on the television is the coverage of what's happening in the country you've just left. And you are extremely concerned for your loved ones, your neighbors, and so on. And so making sure we have the right supports to help people from the moment they arrive all the way through their journey is something that we continue to focus on. The impact of the isolation and extended stays in quarantine hotels, as I mentioned, we're looking to have mitigated by having services offered in many connection points, but in large measure, while the quarantine provisions are in place, it is a little bit unavoidable. Managing the provincial, national, local health partners is extremely time consuming, as I'm sure you're aware. The constantly changing COVID protocols and compliance is, let's call it, interesting. Other infectious disease outbreaks. For a while, we had 3 different public health authorities covering the hotels in Toronto for quarantine, with 3 different sets of rules for managing things like outbreaks of mumps, measles. We haven't had an outbreak of TB, but we've had people that need to be observed, or chickenpox. Has made for very interesting and tight discussions between the service providers and the healthcare providers. And of course, what you deal with every day, the unsolicited, perhaps uninformed advice from friends and family and social media, and how to overcome things like vaccine hesitancy has been a major preoccupation in the hotels. Where are we going next? As I mentioned, we are expecting to be around about 10,000 by the end of the month. We are expecting somewhere in the neighborhood of 100 to 200 individuals to continue to arrive every week on commercial flights. They're literally coming from every part of the globe. The only continent I have not seen Afghan guards arrive from is Antarctica. And it really makes you wonder what the flight paths are from one place to the next. Most commonly, we are receiving them in sizable numbers from Pakistan and Tajikistan, which makes a great deal of sense. But we do expect that this will continue over at least the next 2 or 2.5 years. And of course, chain migration suggests, as we're still seeing large numbers of Syrians come through every stream, both refugee and immigrant, that we will be seeing Afghan arrivals in sizable numbers for many years to come. I'm looking forward to your questions. Thank you.
Wonderful. Thank you so much, Mr. Biles, for that pre-recorded session that we provided to everyone today. Provides a really fulsome overview of the IRCC Afghanistan Resettlement Initiative. Before we jump into the question and answer period, I did want to ask Mr. Biles, it has been several weeks since we recorded this session. Do you have any comments or updates for the audience today on this particular initiative?
Great, thank you very much. It's an odd experience to watch yourself recorded and interesting to see how Tajikistan gets picked up by the subtitles. Yes, we have, the pace has picked up somewhat since we last met. We were looking for 100 or 200 arriving every week by mostly commercial charters at that point. In the refugee world, one of the most surprising things, at least surprising to me, is that third countries that host refugees, while not being overly interested in hosting for long periods of time, often don't facilitate egress of refugees very quickly. And so when my international colleagues can line up charters and exit visas, people tend to move quite quickly. So through the month of April, we've been receiving, in addition to commercial arrivals, charter aircraft arriving at a once a week basis, alternating between those with privately sponsored refugees from Tajikistan and those with government assisted refugees from Pakistan. And each of those flights is somewhere in the neighborhood of 300 individuals, depending upon how many have exit visas and passed their COVID test on any given day. So we are seeing an elevated rate of arrivals, where we expect in April probably about, and continuing in May, about 1,500 arrivals per month for the moment. But when you watch the international news and you see the political turmoil in Pakistan right now as they switch heads of government, either that creates a window of opportunity and we will see more exit visas issued in the short term, or precisely the opposite could also take place. So in the resettlement space, we always have one foot on the brake and one foot on the gas of what we're likely to see. Just to give people a sense of scale, we are continuing to receive government assisted refugees from the rest of the world as well. And so on any given day, we have about 3,000 government assisted refugees in temporary accommodations across the country. That's at both the hotels at the ports of entry from the mass arrivals, but also in commercial accommodations in all of the resettlement communities across the country. At present, about 1,800 of those 3,000 are Afghans themselves. And we have been systematically working with our partners to try to reduce the time in temporary accommodations. I have about 1,800 that are in temporary accommodations as of last Friday for 25 days or fewer, 540 between 25 days and 49 days, 366 between 50 days and 74, 50 between 75 days and 99, and 128 that are 100 days or longer. Our national average, and that's for both Afghan and non-Afghan GARs combined, is about 52 days in temporary accommodations at present, from the moment they touch down at a Canadian airport until they move into permanent accommodations. That's significantly longer than pre-pandemic, but is actually more or less in alignment with where we found ourselves before the Afghan mass arrivals began. And so that's a testimony to the tremendous work that the resettlement agencies are doing to try to keep those times as minimal as possible. Those that are over 50 days are overwhelmingly complex cases, either on the immigration side or the health side, or both. And so we do have a team that Amal leads. She's just recently joined us, looking at the complex cases to try to unpick the Gordian knots of what needs to be done next by whom in order to help those families move into permanent accommodations as quickly as possible, because we recognize that as a really important determinant of public health. The longer that they're in temporary accommodations and in that liminal status, the more of a toll it takes on them. So we'll leave it there and happy to take questions.
Thank you. Thank you so much for that update. That was very helpful. And I will move into the questions in the question and answer box. So we know that the COVID-19 pandemic has created significant procedural backlog within the healthcare system. So the question is, how are Afghan refugees' medical needs being met? What measures have been implemented to ensure that they don't fall through the cracks?
So one of the core responsibilities of the resettlement assistance program providers is to link incoming government assisted refugees with primary healthcare professionals. And as you heard in the presentation, for those that present with urgent care needs, that's dealt with from the airport or in temporary accommodations. In about half of our communities, I would say, maybe a third once we add the new smaller centers, there is a refugee clinic that exists in the community that typically provides the services to recently arrived refugees for their first year, and then strives to connect them to practitioners that are closer to them. In the other communities, it's a much more challenging circumstance in order to make sure that they get connected to primary caregivers, where there are long wait lists for the Canadian born as well. And in those instances, it's typically health navigators at the settlement and the resettlement service providers that are checking in with those families that are almost all government-assisted refugees end up in the case management system for the next year, where someone is regularly checking in to make sure that they're progressing and they're receiving the assistance they need. And a very large portion of the case management work is making and assisting the families to attend specialist appointments in the healthcare system. So there are individuals that are helping them navigate that process, but it's every bit as challenging for recently arrived refugees as it is for Canadians in some Canadian communities to access healthcare systems.
Thank you for that response. And you spoke, Mr. Biles, about some of the challenges that Afghan refugees are facing. How has COVID or the pandemic impacted those particular challenges? And how is IRCC supporting the settlement agencies to overcome these particular challenges?
A lot of the COVID challenges are most evident in the first few weeks in Canada for those that arrive unvaccinated. And so it's being confined in hotel rooms with limited access to escorted visits outside. And until the day 8 test is passed, an ability to move around. And so it's much more labor intensive. It's much more individualized than Operation Syrian Refugee. Just concrete examples of during Operation Syrian Refugee, there would be catered meals and the entire population or a floor or a wing of a floor would be invited down at the same time. So families would get to meet one another and there was more of a social interaction that was possible, as well as the opportunity for various service providers, school boards, Service Canada issuing service SIN numbers to be able to do it in person en masse, which made things much more efficient and quick. While we're dealing with quarantine, obviously the reverse is true and the services need to go to the clients one at a time, room by room, and a lot of virtual delivery that doesn't build that sense of community. And so right from the get-go, I think that many of the Afghan families are finding this more challenging because it's not until after quarantine that they're able to interact and connect with one another unless they've exchanged, and lots of them have by WhatsApp and other social media and are connecting virtually. But as we all know, virtual only gets you so far. So there is a lot right up front of how do we ensure that the families that are coming get connected not only to other recent arrivals, but to Canadians who want to volunteer. And increasingly, as the measures around the pandemic diminish, more Canadians are willing to engage. A lot of the volunteers the settlement agencies engage with tend to be older. And over the last couple of years, there's been a certain reluctance to engage in face-to-face support, and that is diminishing as we move to the next phase of the pandemic. So the agencies themselves have pivoted extremely well to virtual and hybrid services, and now, depending upon the outbreak status at any one point of time in any geographic area, the agencies are putting more face-to-face connections back into place, and that makes a real difference because it widens the range of people who are able to offer assistance.
Great, thank you. And can you tell us a little bit more about when the government will begin to accept applications for privately sponsored refugees again?
Well, the government hasn't stopped accepting applications for privately sponsored refugees. I think part of our challenge is there is a significant number in the inventory of privately sponsored refugees that were received, and we were working through that inventory pre-pandemic. And then the ability for our international partners to provide support for the movement of PSRs and GARs to Canada was almost completely eviscerated in the first year of the pandemic, and has struggled somewhat to come back on stream. So we're still working our way through an awful lot of those applications that came pre-pandemic. There are two, if the question is specific to Afghanistan, there are two specific Government of Canada commitments. There was the 20,000 commitment prior to the election and the additional 20,000 that were committed to during the election. And there is not yet a public announcement on the second 20,000, which I think is normally where stakeholders interested in the private sponsorship space are interested in what does the allocation look like. because in the first tranche, they're primarily those that were already in the inventory, those referred directly by partners that have been identified in public announcements by the department. And also every sponsorship agreement holder was given a certain number of spaces in order to try to prime the pump and get things moving as quickly as possible. But for new groups of 5 and others that are interested in moving into the private sponsorship space, the policy from the government hasn't been announced yet. We are expecting it imminently, but just manage expectations. There is a blackout on Government of Canada announcements after a budget that runs for 2 weeks. So if it's not directly referred to in the budget, typically any other announcements have to wait until after that 2-week period has passed. The budget was last week, so we're into our first week of that period.
Okay. Thank you very much for providing that information. And there is a question here, and I'm just going to summarize what I believe the speaker is asking about. How are vulnerable populations being prioritized by IRCC, such as those who maybe have not lived in Afghanistan for years or be coming in through a humanitarian program, but are under immediate threat?
So typically under the humanitarian aspect of that first 20,000 commitment, we're taking referrals directly from the UNHCR and some of the other international partners that have been identified in the press releases. So human rights defenders, for example, the Rainbow Railroad, and a few others. And that's where the referrals are coming from for that first tranche of commitment. And the public announcement of the second 20,000 and how that will be distributed across the possible categories and referral partners hasn't been announced yet.
Okay, thank you. And the next question, I think you've spoken to this a little bit, but perhaps you can expand a little bit more. We hear from Afghans in the hotels in Toronto who have arrived in early March that they still don't have a caseworker and might be stuck in a hotel. So is there any plans on increasing the number of caseworkers within those hotels?
Well, we watch on a daily basis how many individuals are in hotels in Toronto and elsewhere, especially for those where we have mass arrivals. There are 3 different sets of hotels in Toronto at present. So there are the port of entry hotels, which receive the mass arrival flights, typically the charters, where people are quarantining. And then there are those that are managed by Polycultural in Mississauga and those managed by Costi in Toronto for the families that their end destination is either Mississauga or Toronto. And from those hotels, that's where the different permanent housing options are shared, is not the right word, where it become available to the clients, and they're shown a number of them until they find one that works for them. And they're encouraged to do so reasonably quickly because we are trying to help the next family that's coming through. And so it would depend which set of hotels we're talking about with the caseworkers. I think there's only 99 rooms that are occupied at the POE hotels right now, and there's a staff of 35. So all of them are seeing resettlements workers every day on a range of issues and are working their way through testing and IMEs and all of the rest of that. And so if it's Mississauga or the Costi hotels, it would be a different question. But even there, the number of people in the hotels has diminished significantly over where we were at in the fall because the rate of those arriving in those 2 communities has diminished. And the move out rates and the number of days in temporary accommodations has fallen dramatically. And in those hotels too, there's regular movements and activities and town halls that are being held. So it would be very surprising to me if there are individuals that are not seeing resettlement workers on any given day. If people know of some, then by all means, provide me with specifics by email and I'll make sure we look into it. But there is kind of planned interaction from a wellness perspective with every family member on a regular basis in the hotels.
Wonderful, thank you. And can you tell us a little bit more of what's to come for Canada welcoming Afghan refugees? For example, what can we anticipate in the next year, maybe 5 years? Can you tell us what's coming ahead?
Absolutely. And so like resettlement and settlement is the journey of a lifetime. It is not measured in days, months, or years. And so we're very aware that our first arrivals in this wave of the Afghan arrivals, because there were previous waves, began last August. And their federal income support, if they're a government-assisted refugee, or their private sponsorship income support, only lasts for 12 months. And so month 13 will be upon us reasonably quickly. And so we've begun a process of looking at across settlement, what does uptake look like for settlement services, because we want to know as they pass from the resettlement program to the settlement program, not only have they been successfully housed, and their kids are in school, they've got their SIN numbers, they're receiving RAC income support, but we want to make sure that the adults have had their language assessed and have the opportunity to take English or French training opportunities, particularly in the year of income support, so that they can do that full time and not juggling jobs if they don't wish to do so. Similarly, those that are school aged, we're looking at their interaction with the settlement worker and school system to see across the 41 resettlement communities that I have responsibility for, what are the averages and the norms? How does that stack up in comparison to other government assisted refugees? Are there variants between the privately sponsored and the government assisted? And so we are moving systematically through each aspect of the settlement program to look at what, because we have a tracking system service providers enter in when they serve clients. So we can see where we have either super successful programs that are receiving almost everybody, or the reverse, where we have communities that are significantly behind the average in terms of uptake, so that we don't have any bottlenecks that last for very long. And so we will be shifting to look at language training next, summer programming for youth, because especially children and youth that are school aged, their parents tend to drop out of language class for the 10 weeks when school is not in session if we don't have appropriate programming. So we will be tracking all the way through the coming year or so to see how things are working from a service provision perspective. And we have worked with an academic network led by Dr. Laurie Wilkinson in the University of Manitoba to do multiple point-in-time large-scale surveys of the Afghan cohort as they move through their settlement experience, so that we can get the feedback and identify where we have some snafus. We definitely know from Operation Syrian Refugee that some people felt very well supported for their first 12 months and felt less supported afterwards. So a lot of emphasis on figuring out connection points to other Canadian systems in the neighborhoods where people live that's not necessarily settlement, but ensures that they have that connectivity. So we can, as a department, track right up to the point of naturalization, the application for citizenship, and see what that looks like and make sure that nobody's being left behind. But beyond that, we then shift to Statistics Canada and tracking longer term outcomes. But it won't be 5 years, it will be decades that we're watching how this population works, and with our federal and other partners trying to unpick roadblocks and obstacles that we don't even know will be there until we start to get that feedback.
Great, well, thank you so much, Mr. Biles. It's always a pleasure. We are out of time for the questions that are in the question and answer box today, but we will download them and we will just send them to you so you're aware of what some of those questions are. And I'd like to turn it back to you. Do you have any closing remarks for the group today before we segue into the launch of our Afghan Resettlement Toolkit?
Great. Well, thank you so much for having us. The work that you do, I think it's 72 that I see have joined today, are integral to the success of the enterprise. None of us can do this alone, and the refugees bring so much to the table that they themselves put into play, but they too can't do it without your assistance. So a heartfelt thank you from us collectively, knowing that we're all in this together. And without that commitment, we wouldn't be as successful as we are at tackling the challenges as we encounter them.
Thank you very much. And I'm now going to transition over to our launch of the Afghan Refugee Resettlement Toolkit. This product has been in the works for a few months now. And before we do that, I just want to acknowledge the co-leads of the N4 Afghan Resettlement Community of Practice Working Group, Mr. Ahmed Majid. Ahmed was unable to be here live today, but he did pre-record some remarks, which we'll share with you momentarily. And Mr. Majid is of Iraqi descent, and his family came to Canada from Kuwait to escape the unrest during the first Gulf War in 1990. After volunteering at different settlement organizations, such as the Saskatoon Open Door Society and Saskatchewan Intercultural Association, he found employment with the Saskatoon Open Door Society in the Employment Services Unit in 2014. During this time, he performed the role of the employment counselor and a team lead, where he took pride in working directly with newcomers in their search for employment, and as well guiding and supporting his staff to ensure the best service possible. He is working as the executive director of SAISHA currently for the last year and a half, and is passionate about working collaboratively with all the settlement organizations in Saskatchewan, with the collective goal of continuing to elevate the settlement services for newcomers in the province. And our next speaker, who is joining us live, and the other co-lead for the N4 Afghan Resettlement Community of Practice Working Group, is Dr. Rachel Talavlicker. And Dr. Talavlicker is a primary care physician dedicated to providing equitable, high-quality care for marginalized populations, including refugees and immigrants. He completed medical school and residency with additional training in global and women's health at the University of Calgary in 2014. Prior to medical school, Rachel worked overseas in Switzerland and India with the World Association of Girl Guides and Girl Scouts, after completing a degree in electrical engineering at the University of Alberta. Her current clinical practice is based in Northeast Calgary at the East Calgary Family Care Clinic, where she is medical director in the Mosaic Refugee Health Clinic. Her fascination with the influence of culture on healthcare, as well as advocacy for refugee care, underpin her research pursuits. She currently co-chairs the MRHC Academic Governance Committee and is a member of the North American Society of Refugee Healthcare Providers Research Committee. Thank you so much, Rachel, for being here today. And I am now going to begin the launch of the toolkit with some remarks from Ahmed Majid. Looks like this video doesn't want to play. So I might just ask my colleague Andrew to just share his screen to play this video for us. Thanks so much, Andrew. Maybe while we're waiting for the video, Rachel, do you have any opening remarks?
Hello, everyone. My name is
group?
Ahmed Majid, and I'm the Executive Director of the Saskatchewan Settlement Umbrella. So for the last 6 months or so, I've had the absolute pleasure and honor of co-chairing the N4 working group that helped put together the Afghan Refugee Resettlement Toolkit. This has been such an excellent experience to be working with so many leaders in the healthcare and settlement sectors, and really watching those two worlds converge for a common goal: helping assist professionals who are working to support Afghans and providing equitable access to services across the country. Throughout the process, we've came together as a group on a monthly basis and collaborated to bring the Afghan Resettlement Toolkit from vision to idea stage to ultimately a tangible and beneficial virtual toolkit that covers areas such as settlement, healthcare, education, employment, community connections, amongst others. We do hope that this toolkit can provide strong benefit to healthcare and settlement practitioners throughout the country that may be working with someone from Afghanistan. And we hope that with this toolkit, we are able to create more equitable, understanding, and informed society that can help pave the way for a successful settlement and integration journey for all our country's newcomers. And so with that, I want to thank you for this opportunity to be able to share on the toolkit. And we'd like to dive a little bit deeper in terms of the makeup of it. So to get us started, I'd like to provide a high-level overview of the Community of Practice, or COP, model that formed our working group deliverable. The N4 COP Steering Committee is chaired by Jean McRae and Tim Holland. And the COP Steering Committee, it meets quarterly, follows the terms of reference, and provides guidance and strategic oversight of the working groups themselves. The COP Steering Committee is assisted by members of N4 team to help guide the membership efforts and corresponding working group projects. The COP structure includes time-limited working groups that have a goal to produce evidence-based, outcome-driven, and impact-focused deliverables to address the root causes for inequities for newcomers in accessing health, social, and settlement services. The COP Steering Committee ensures the working groups have the support they need to advance their work. Now, reviewing the timeline of the N4 COP, I'd like to focus especially from September 2021 onwards. So in partnership with the COP Steering Committee, a survey was developed in the summer of 2021, which was asked which issues the working group should focus on before they were launched in the fall. The COP Steering Committee members were presented with the top 5 issues, and a poll revealed that the 2 key working group topics was number 1, access to interpretation services, and number 2, Afghan Refugee Resettlement Toolkit. In the end, the working groups launched in October, and 4 monthly meetings were held in each group between then and March, and now the deliverables are complete. And so in the fall of 2021, N4 launched 2 working groups, each with its own deliverables. I had the privilege of being the co-chair of the Afghan Refugee Resettlement Toolkit working group with Rachel. We were set with the deliverable to form a resource toolkit composed of existing curated materials to support Afghan refugees accessing and experiencing health and social services. Our working group included professionals who work with newcomers, and these professionals were from the health, settlement, and social services sector, and worked together to identify barriers and find solutions that support equity for newcomers. Our working group aimed to be a space for members to connect with their peers and work collaboratively on a focused project in the field of newcomer support. Members knew that involvement in a working group would be a short time limited commitment, and each of the 4 monthly meetings per group was planned for between 1.5 to 2 hours at a time. The N4 team supporting the work the N4 team consistently supported the work by engaging and preparing the co-leads for each working group meeting, creating a project charter and work plan for each group, conducting research, and by organizing and supporting the working group meetings and corresponding subgroup meetings, and by completing the working group summary documents. And I can just tell you that without their support, this project wouldn't have been able to come to fruition. So we very much appreciate everything that they did for this. So I don't want to spend too much time on this slide right here, but this slide really shows an overview of the working group cross-sectorial membership of 18 different people that made up the group. And a huge thank you goes out to each and every single member and all the contributions that you made throughout the process. And here's a nice little action shot where you see all the smiles on the face, because I believe when this picture was taken, we were very close to the finish line in terms of getting the actual toolkit up and running and ready to share with all of you. Just to provide a high-level overview of what we did, the end of January, we researched existing resources in the field of Afghan resettlement and grouped them by categories. In February, we curated existing resources and created a first and final iteration for the online toolkit. In mid-March, we launched a communication strategy for the release of the toolkit. And as of right now, the toolkit is live. So with all that, I would like to pass it to my esteemed colleague, Rachel, to now share more about the toolkit itself. Thank you.
I'll unmute myself. Okay, so I'll say thank you in his absence to Ahmed, and good morning or afternoon to you all. And thank you for the kind introduction, Mariah. I am a family doc here in Calgary, which is the home to Treaty 7 peoples, as well as the Métis Nation 3. So it's my honor to come to share this work with you. I'm going to share my screen in a moment and bring up the toolkit. But before I do, I also want to acknowledge a comment that was made in the chat as well around Afghan representation in the voice, the first voice experience in the toolkit. And although Ahmed didn't speak to it in his slides, there were people of Afghan origin who were involved in our working group meetings and who also there was a special consultation done with people of Afghan origin. So, but it's something that we've identified we want to do more of for future working groups. So I hear you, and if you are of Afghan origin, look to engaging with us in future projects, because that's what you say is absolutely correct. So without further ado, I'm going to share my screen here and bring up our toolkit, which we're very excited about and look forward to sharing here. One moment. Okay, so when you come to the N4 website, I'll just take a moment to orient you. I am signed in as I'm a member of, or actually now it's signed me out because we've been doing the webinar, but you can sign in if you're a member of N4, but if you're not yet, you are able to access the toolkit and all of its resources as an open access source, because we wanted to reduce any barriers that there were in people accessing resources. And the toolkit itself is blog based. And so you'll see here the opening blog that you'll come to when you click the link, which I think Andrew was going to post in the chat as well for us when you first open it up. So you can see here that we've provided a bit of history around the toolkit and how it came to be. And this is the list of topics which the various consultations we did with members suggested were the important ones to highlight. We've also included on here an opportunity where you're able to provide feedback, both on the content as well as if there's further content that you would like to see involved. So you're able to click on that link and it will bring up a form here that you can see in a moment, where you'll be able to provide extra feedback, your name and address, and email, and connect with us. Okay, I'll just go back to the blog. So I'm also going to show you then, when you come to the homepage of N4, you can see the toolkit will come up along the banner, and you browse the toolkit by clicking on that link there. It brings it up. So as I mentioned, it is blog based. So what that means is the topics are listed here in blue, and then the items that you're able to search for are underneath. And the nature of the blog is that you're only able to see the top 3 items that are there, but we've got a little prompt here to show and remind you to click the heading for the full list of resources. And so, as I mentioned, there's the top introduction. This will link you back to that introductory blog. And then you can scroll down. So the categories include resources in Afghan languages, information on settlement, education and childcare, community connections, Afghan culture and society, research, studies and ethics, trauma-informed care, healthcare, and then we have the a collection of arrival applications that are available to many of our, some of the provinces have those specific to their province. So I'll just come back up to the top and we'll show you an example here. And so let's say we come and you would like to look up something in Afghan culture and society. So if you click on that link, then it will give you a deeper dive of a full list of resources. Now in this example I've chosen, there are also only 3. Let me go back. I want to show you one that's got more so you can see how that looks different. I'm going to come back up to the top. So if we come to resources in Afghan languages, for example, you'll see here there's more options, and they will show you the date they were added, the title, the source that they came from, the date and type as well as where they were produced, because some of the materials we have shared are produced in the United States, but they've all been reviewed in a process where we've ensured that the appropriate and accurate to the context. Okay, you can click back just to come back over here. Another feature that was important to the working group members was that you could see most recent items first. So the blog actually sorts by date, and so they're included up at the top. And then if you would like to search anything, we have a search engine on the side. So you could come over, so example, keeping with the theme of languages, if I wanted to search for Pashto resources, and I will search, then it will bring up resources that link to that. And it's not just that the title includes the word Pashto. You can see here a number of different resources that have been pulled with that search term. So for example, what to expect at a women's doctor appointment. When you click on that link, the reason that that has picked up is that it comes up and there is, well, it's not giving me the search box, I think, because I went on to it earlier today, but you are able to get these resources in the Pashto language, and it does pop up and ask you that choice. So the search engine is actually quite savvy in terms of helping you look for what you need. Okay, the other thing that I just wanted to add is that if you have other feedback, I showed you the first contact us link. We've also integrated a survey that you can do. So right here at the top of the blog, it shows let us know. You can click on that. And we've actually included some feedback questions that ask, because we'd like to know, if this is helpful, who it's helpful for. You can enter in what type of organization you're from, what your thoughts were on how the blog was set up, and who you think you might be able to use it with. And then, certainly to share with us comments as well as any other content that that you wish that that we had included. Our amazing team at N4 are actively going to be receiving the emails that you send in with other resources, and they will sort them and ensure that they get tied to the various categories. And if you do have a resource that might fit in multiple categories, we're able to post them in both of those. So I'm just going to stop sharing my screen there for a second and come back to the main page. Oh, actually, before I do that, I knew there was one other thing I wanted to show you. Another way to get to the toolkit other than on the homepage is actually if you come up to our network on the top and click on Afghan Resettlement, then it will bring you to the toolkit as well. And when you get a chance to sort of play around on the website, you can see Community of Practice also has a link. And the toolkit, we hope, will become a model for other arrival communities. And so there's actually on the homepage, you'll see there's a briefer form of a toolkit that's already started to be prepared for our Ukrainian arrivals. And our hope is that it might be able to be expanded to other countries of origin. I'm going to stop sharing my screen on the website there, and I'm going to start sharing our PowerPoint here just to as we wrap up here. So just bear with me one moment. Okay, so hopefully that that brings up our what's next steps here. So where we go from here is that through hopefully sharing with you all today, as well as some other opportunities that we have to showcase the toolkit, because it truly has been an opportunity for those of us in the healthcare sector to meet and work with those of us in the settlement sector, because as many of us know on the front lines, those bridges can sometimes, or those places can be difficult to navigate and bridge. And so we are looking forward to further opportunities to do that. We will be presenting this work at the Canadian Healthcare Navigation Conference next week. So if any of you are attending that, we look forward to sharing more with you, as well as at the North American Refugee Health Conference, which will be in Cleveland later this summer. There have been email templates prepared in both English and French, so to be shared across the country to other people that you may work with in healthcare or settlement to spread the word about the toolkit, as well as other processes that we're using to try and disseminate it on social media, etc. And so we very much want your feedback. We've built this for all of you that are here today, and for those who will continue to receive Afghan patients over the next few years. Here in Calgary, we are also a resettlement hub. I know Mr. Biles spoke mainly about Toronto, but we are receiving plane loads weekly here too in Calgary, and people are being disseminated across the Western provinces from here. So even if you haven't yet had many come to your community, certainly soon we will. And so we hope that when that time comes, you're able to remember this and reference the toolkit and share with your colleagues. And with that, I'm going to hand over to Mariah.
Yes, well, first of all, congratulations, Rachel. This is really, really exciting, and I know it came together in a matter of months. So thank you so much for all your efforts leading the Community of Practice Working Group. And before we jump into closing, I did want to ask if those on this call today go to the toolkit and see any resources that might be missing or ones they've recently come across that might be helpful. How can they have these added to the toolkit?
I think
Are you?
I was just going to say, is that me causing the music?
I don't hear any. I don't hear any music on my end.
Oh, okay. I'm going to stop sharing my slides because when I share my slides, the N4 music comes on. So I'll let you finish up, Mariah.
Okay. Thanks, Rachel. Sorry, I wasn't. I'm not sure if others are hearing. Maybe it's just. Yes, and Rachel, I just asked if people want to add resources to the toolkit. Is there a form? There's a form on the toolkit that they can have those resources added. Great. Okay, so with that said, there is an opportunity to provide feedback on the toolkit. We're very excited about its launch, and it's an ongoing priority for N4 to continue to communicate this more broadly with our partners. If anyone on the webinar today has suggestions of those folks we might be able to reach out to, please don't hesitate to contact us. I'm just going to share a slide here that has the email for Andrew and I. And I also wanted to make you aware of some upcoming events that N4 is hosting. So we have an upcoming webinar next Wednesday in N4 Reconnect, where we're sharing findings from our dual pandemic, our key findings from a needs assessment that took place during the dual pandemic of COVID-19 and systemic racism. And then on May 4th, we will be sharing more about our recently developed position paper that outlines some national standards and recommendations for healthcare equity. So we do invite you to attend those events. We also recently launched a mobile app for N4. It's available on Android and it's available on Apple. And more information can be found on our N4 website about this. And finally, if you missed any part of today's presentation or would like to watch the session again, the recording will be on the N4 platform within the next week. We also want to continue the dialogue that the webinar started today. So we will be moving any questions that did not get answered into N4's meeting place. And finally, following today's session, you will be invited to complete a survey to share your feedback with N4. These surveys help us continuously improve and seek out new webinar content and opportunities that are responsive to you. So please do follow the link to complete this brief survey. And my colleague Andrew is also going to put a link in the chat that can take you directly to the toolkit, as well as to join and become a member of N4. And I'll just maybe ask Rachel, do you have any final remarks for the audience today?
Just to say thank you for taking time. We know everybody is very, very busy right now, and we're very grateful that you've taken the time today to come and learn about this work. And please, everyone, take care of yourselves, because it's a difficult time for everyone at the moment, and we all are trying to help lots of people every day, and wish that we could give them everything all at once. So it will come, hopefully, as we get more resources. And thank you again for being here, and a huge thank you to the N4 team. It's made our jobs easy, and certainly it's been a real gift to have an opportunity for healthcare and settlement sectors to work together positively towards something concrete. And so we look forward to more opportunities to do the same. Thank you.
Thanks again for joining us, everyone. Stay safe and be well.